previous papers, or if you ask anyone, commonly asked question is describe enzyme induction and enzyme inhibition of the drug with example and its relevance. Okay, pharmacological relevance. Again, I would like to repeat here that in absorption, bioavailability was one of the point parameter which was very important to understand and applied it. In distribution, plasma protein binding was again, it was an important point which I discussed and its clinical relevance. And for today's lecture, enzyme induction and enzyme inhibitions and its relevance. So these type of the questions we ask, as well as these objective is very important, because throughout for pharmacology lectures for all systemic pharmacology, these points will be there, and you have to apply these issues during the systemic pharmacology. So the 4 objectives, specific objectives for today's class. This figure. Now the next is the distribution. Drug has already stored in tissue, may be bound in proteins, and then it become free. Now it has acted on site of action. Now required is the biotransformations or the elimination. So here, what is the elimination? Elimination means the term you know. Termination here related with the drug is termination of action of drugs. So elimination means it includes both process of pharmacokinetic, that is metabolism and excretion. So please remember that only excretion will not considered as elimination. Even the metabolism also terminate the action of drug. So metabolism and excretions, they include in this term, that is termination of action, elimination of drug. The second definition is biotransformation. What is biotransformation? Biotransformation means, you know, biotransformation is a chemical alteration of drug in the body. So chemical alteration of drug, why it is required? Here pharmacological relevance is to make a drug water soluble. Please remember again this term, water soluble, lipid soluble, non-polar, polar, unionized and ionized drug. So water soluble, whatever the lipid soluble drugs which is absorbed, distributed, now there is a chemical alterations to make that drug water soluble. Okay, that is the importance of biotransformation. Now, what is the need for this metabolism? You can say biotransformation. Why this chemical alteration is required or the metabolism is required? Because biotransformation can make a drug inactive, which you required, because already the drug has reached to the site of action. It has already acted. Now you require to that drug to become inactive. So the first purpose of biotransformation is that it can make a drug inactive or maybe less active. So I mean the purpose for the most of the drugs for biotransformation is this only. You require to make a drug inactive. Fine. There is another purpose of biotransformations, means the biotransformation can produce a more active metabolites. Please remember, first is most of the drug they become inactive or less active, but there are certain drugs. Again, here comes the drug factor, drug characteristics. There are certain drugs which produce more active metabolites. Though they are active, means you can say it is inactive outside, and after entering into the body, of course, sometimes they become active. That is the third point. Produce more active metabolites means outside also it is active. After entering into the body, that drug will produce active metabolites. There are certain examples which I have written here. You all have to remember these 2-3 names. Say for example, I have written here diazepam. Again, you all know that diazepam, it is a sedative hypnotics, or it can be given in the patient suffering from insomnia or maybe the sleep disturbance. So suppose diazepam has given to the patients, there are the characteristics of diazepam that outside it is active, but after entering into the body also it produces active metabolites. So its active metabolite is oxazepam. Okay, just now you remember the second point of biotransformation. The third point is biotransformation can activate an inactive drug to active. So there is a dosage form outside the drug is inactive. But after entering into the body and whatever the process of pharmacokinetics, the third process, metabolism will, get the drug to active. So active is, that is called the prodrug. Remember the difference between this prodrug and the second point. Prodrug किसको बोलते हैं? The drug which is inactive outside and it become active during this process. Okay. So active one. Example I have written here, levodopa. And levodopa can produce dopamine, which is an active one which required for some purpose. You know that levodopa and this dopamine, it is the drug of choice for the patient suffering from anyone. You know, you must have studied in physiology. Where does this levodopa is required? In Parkinson's disease, right? So the levodopa and dopamine. So levodopa is a prodrug and it produces active metabolite, which is called the dopamine. And dopamine deficiency can lead to Parkinson's. So